Welcome to this presentation, Insulin Pumps the Basics. My name is Melanie Beatty, and I'm the Regional Knowledge Coordinator for Chronic Disease and Primary Healthcare. I will be your narrator throughout this presentation. The presentation will take approximately 15 to 20 minutes, and you may pause the presentation, stop the presentation, or rewind the presentation at any time. Let's get started. Let's start with the objectives of today. First, we will define insulin pumps. Then we will review how insulin pumps work. We'll discuss reservoirs and infusion sets, basal and bolus insulin, benefits of the pumps, challenges of the pumps, and finally, available pumps in Canada. Insulin pumps are essentially a small battery-powered microcomputer. They're about the size of a deck of cards, and you'll see clients often wear them clipped to their waistband, in a pocket or pouch, and sometimes on their belt. It contains a reservoir or cartridge that's filled with rapid-acting insulin. The insulins are NovaRapid, Humalog, or Apidra. Now let's talk about how insulin pumps actually work. As you may or may not know, insulin pumps are programmed by the user to give out small amounts of insulin throughout the day. The insulin is delivered from the pump through an infusion set. The infusion set includes a sub-Q cannula, an adhesive mount, a quick disconnect, and flexible tubing that connects the infusion set to the reservoir which holds the insulin in the pump. Let's talk about this in more detail on the next slide. The pump houses a reservoir of insulin. It delivers the insulin to the body through flexible tubing and the subcutaneous cannula. The amount of insulin delivered is programmed by the user. Insulin pumps are quite advanced, and they can alarm when there is no insulin being delivered, when it's been discontinued, or even programmed to prevent the user from accidentally dosing too much insulin. Both the reservoir and the infusion set need to be changed every 2 to 3 days. In order to remove the infusion set, simply remove the tape that's covering the catheter or cannula at the insertion site. Gently pull the catheter or cannula under the skin away from the body. In order to remove the insulin reservoir from the pump, you simply twist and pull. Patients may need to disconnect from the pump for short periods of time, such as for bathing, and they may do so using the quick disconnect. This allows them to temporarily disconnect from the pump without having to change the infusion set. They hold the adhesive in place by placing a finger just in front of the cannula housing, and they gently squeeze the sides of the connector. Then they pull the connector needle straight out. They can reconnect to the pump when needed. There's another type of insulin pump available in Canada, and this is the pod system. As you can see from the photo, there are no tubes involved. The pod is a full insulin delivery system. In fact, the small pod that you see on the screen houses the insulin reservoir, infusion set, automated inserter, pumping mechanism, and power supply. Insulin delivery amounts are controlled wirelessly through a handheld device. If the patient needs to remove their insulin pump, the entire pod system is removed from the body. It simply needs to be lifted off of the skin. The entire pod needs to be replaced every 3 days. Each pod contains about 200 units of insulin, which is typically enough for 3 days. The unit is also waterproof for up to 60 minutes. Insulin pumps try to mimic the natural processes of the pancreas. Throughout the day, the pancreas releases small amounts of insulin to control blood sugars between meals. We call this basal insulin, or a basal rate. After a meal, particularly one that contains carbohydrates, the pancreas releases a larger amount of insulin, and this is to control mealtime blood sugars. We call this an insulin bolus. Insulin pumps attempt to mimic this process. If you can recall from our previous slides, we mentioned that insulin pumps only take rapid-acting insulin, so you might be wondering why we have basal insulin and bolus insulin. Well, they're actually rates, so we're going to talk about the basal rate first. The basal rate is a small amount of background insulin delivered continuously. The basal rate keeps the glucose levels in target range when no food is eaten, so this is between meals and overnight. The pump can be programmed to deliver different basal rates throughout the 24-hour period. This is based on individual needs. You can actually set temporary basal rates and use them for different things such as activity, illness, or any other temporary changes in routine. If we take a look at the graphic below, the blue line represents the basal rate. Now let's talk about the bolus rate. So the bolus rate is still rapid-acting insulin. It's just a larger amount of that insulin delivered over a short period of time, unlike the basal rate, which is a small amount of insulin that's delivered continuously. A bolus can be given at any time, but it cannot be pre-programmed like you can with the basal rates. In most cases, a pre-meal bolus is given based on the grams of carbohydrate that the patient is about to eat. A correction bolus can also be given. This is an extra amount of insulin given in order to correct high blood sugars. If you look at the graphic below, the orange lines represent insulin boluses that the client is given with their meals. Let's move on now to our next topic. At this point, you might be wondering, with all of the functions of the insulin pump, can it measure blood sugars? Unfortunately, the answer is no. Patients still must check their blood sugar approximately 6 times per day in order for pump therapy to be safe and effective. Now, there are some real-time continuous glucose monitors called CGMs available, and they can work with some insulin pumps. Basically, they are a transmitter and a sensor, and they're inserted separately from the pump site. Whether a patient uses a standard blood glucose monitor or the CGM system, blood sugar testing and review of the results is vital for safe pump management. Let's do a quick review of the insulin pump benefits. First, there's precise dosing. The insulin pump allows for very precise, exact dosing that can be matched to the patient's unique needs. Next, there's flexibility for the patient. They have flexibility in the timing and the size of meals, but they also have flexibility for changes in routine, such as travel. Next, there's more predictable absorption. This is because only rapid-acting insulin is used, and the patient typically only uses the abdomen, buttock, and hip area. There's also fewer and less severe blood sugar lows. This is again because of the more precise insulin dosing. Overall, this results in improved control of diabetes. Let's review the common challenges of the insulin pump. First is the risk of DKA or ketoacidosis. This is because the insulin pump only uses rapid-acting insulin. That means that if there is an interruption in insulin delivery from the pump, your patient's blood sugars can rise very quickly. Ketones can start to develop within a few hours without insulin. It's advised that all pump users carry an insulin pen with them of rapid-acting insulin, and they need to be prepared to use it if they have 2 unexplained high blood sugars in a row. They also need to check for ketones if their blood sugar is over 15 millimoles per liter. Next is the risk of infection at the infusion site. That's why it's so important to rotate the site every 2 to 3 days. There's also the risk of hypoglycemia, and this is because of the tighter control that can be achieved through the insulin pump. It's interesting, however, that the hypoglycemic episodes tend to be less severe on the pump. Next, there's weight gain and suboptimal nutrition. In some cases, improved blood sugar control can actually lead to weight gain, and this can be exacerbated if the patient starts to have suboptimal nutritional intake. For some patients, body image concerns and psychological adjustment are a challenge of the insulin pump. Finally, there's a steep learning curve. It can take a while for the patient or caregiver to become comfortable with the insulin pump. Currently, there are 3 insulin pumps available in Canada. Those include Animas and Medtronic, which are the tube systems, and Omnipod, which is the tubeless pod system. Let's conclude today's presentation with a quick review of what we covered. We reviewed the definition of insulin pumps, how they work. We discussed reservoirs and infusion sets and when they need to be changed. We discussed basal and bolus insulin rates, the benefits of pumps, the challenges of pumps, and finally, the pumps available in Canada. If you'd like to know more about insulin pumps, we encourage you to review the BC Children's Hospital website, which has some great insulin pump resources, as well as the Animas Medtronic or Omnipod websites. Thank you for your attendance.